innovative content, global audience.
Tooth decay begins when a bacteria in your mouth makes acid that attacks the tooth surface. This can lead to a small hole in the teeth called cavity. If tooth decay is not treated, it can cause pain, infection, and even tooth loss. People of all ages can get tooth decay once they have teeth, from childhood through to adulthood. And of course, tooth decay causes severe pains that are most likely is very, very unbearable. If you've been there before, you understand what I'm saying. And on the show today, we should be talking about the signs of tooth decay, prevention, and good dental care. Of course, we're going to be discussing as well healthy foods and drink, things that can actually lead to or cause tooth decay or can give you anything like that in the future. Good afternoon to you and a very warm welcome to you. This is our health, where your health comes first. My name is Princess Kessy, reaching you live from our SRO TV studio here in London, the world's capital city. I have with me on the show today, yes, I brought you Dr. Edruze Isaiah, Medical Director of Bala Delta Dental Clinic. He is here to tell us whether the norm that sugar and chocolates can cause tooth decay or whatever it is, which food. They used to tell us don't eat sugar, don't take chocolate, don't take ice cream, don't take this, don't drink that, you're going to have a bad tooth. Now he's here. I brought him on the show today. You can ask your questions. Of course, you can put a call through, drop your comments to ask your questions. Health is wealth, and that is why we're here this afternoon. Welcome to you, Doctor. Good afternoon, Doctor.
Thank you so much.
Yes, quickly, Doctor, what is a tooth decay? When you hear the word tooth decay, can you explain to a layman what that means?
Okay. Tooth decay simply is a decay of the tooth. Normally, the tooth is very hard, very strong, especially the enamel. But when there is a decay, it becomes very soft. So tooth decay is the softening of the tooth. Then it becomes too soft, then a hole is formed on it. So simply put, for the layman, that is what tooth decay is.
Wow. And what are some of the causes of this tooth decay, Doctor?
Okay, there are different causes of tooth decay, and because it is caused mainly by bacteria, and bacteria acting on carbohydrates produces an acid, and it is actually the acid that does the work of dissolving the tooth. So there are anything that can improve the acidity of the mouth or produce more carbohydrates will certainly increase tooth decay. Things like sugar, any sugary thing, that will include ice cream, biscuits, and all that. So anything that contains much carbohydrate will give a substrate to the bacteria to act upon, and then produce that acid that will dissolve the teeth.
Now, when you say anything that has carbohydrates, that means even the swallow we eat, some of the swallow can lead to tooth decay?
Not quite. Anything that is chewed within the mouth.
Anything that is chewed within the mouth.
So yes,
even rice can cause it. Not necessarily ice cream, chewing gum, or sugar, right? These are some of the things we need to take on the show today, sir.
If somebody keeps such things in their mouth, as long as they are capable of producing sugar, it will cause tooth decay. So, and that is why, okay, maybe when you will ask me about the prevention, I may go into that, but any food substance that is left in the body becomes a substrate for the bacteria to act upon. And once it's a carbohydrate, they can turn it into metabolize it and then form an acid from it.
Now, sir, apart from the pains that comes as a sign of a tooth decay, what are the signs? How do you detect? How do you know whether or not you have a tooth decay or something is wrong with your tooth down there?
Okay. So no, you may not know that you are having a decayed tooth initially. Most of the people only come to know when it has become too late. So the early stages is that there is a shock when you drink ice water or take something hot. So
Okay.
people tend to ignore those warning signs. So it's a shock. It starts as a shock, which will last for just a moment. Then as the decay is progressing, the duration of the shock will be more. By the time it's giving frank pain, it means that it has gone too deep.
Okay. Now, sir, can a tooth that is decayed already, can it be fixed?
Okay, yes, in a decayed tooth can be fixed. Similarly, just as if a part of a yam is decayed, you can cut it off and then cook the remaining part. So there's a treatment called filling. Filling involves removing the decayed part, and the resultant cavity is
Okay, a little bit of network issues there. This is go ahead, sir. This is quite an interesting topic today because your chief host, your presenter, you'll be shocked that I did 3 extraction already. I don't have 3 teeth as you see me like this. So it's a very, very sensitive topic. It's a serious topic. You don't have to take this show today lightly because this is something, I know a lot of things that could damage your tooth, like what he said. A lot of ice cream, a lot of chocolates, a lot of this and that. Go ahead, doctor. We can hear you.
Hello, can you hear now?
Go ahead, sir. Yes, sir. We can hear you.
Okay.
Okay, sir. So how long can
Yes,
you
you can.
leave a decayed tooth without treating before you start feeling, that excruciating pains that comes with toothache?
You said?
How long can you leave a decayed tooth without treatment before you start feeling that excruciating pains?
Okay, it varies from person to person, but
All right.
master with children. Yeah, so not give the exact time because person.
Okay, doctor, can you turn your phone around? We need you to turn the phone around the way it was. Hello, doctor.
Yes, I'm doing that.
Yes, hello, viewers. Today's topic is tooth decay. We know that we live in a society where, if I'm not lying, 80% of people, one way or the other, you've once had a tooth decay or a toothache. That is the most painful thing you can ever have. Like the most painful pain. It's excruciating. It's tormenting. It's I don't know how to describe the pain. I have been there. I had to I did extraction 3 times already. In fact, this doctor did the last one, and that is why I brought him on my show today. It's quite excruciating, it's quite painful, and that is why I said we should discuss about it today. Doctor, you need to sit back a little so we can get to see your face properly. Yes. So what are the stages of tooth decay? They have stages: stage 1, stage 2, stage 3. What are the stages, sir?
Okay, basically 3 stages is most of the time on the enamel, which is the white part that we see on the teeth. Beneath the enamel is the dentin. So the decay starts from the top, and then when it goes down to the dentin, when it is in the enamel, you don't feel any pain until it is getting close to the dentin layer. It's then that it begins to give warning signals like shock, like slight pain when you take something hot or something very cold. Then, but most people tend to still ignore at that stage. Then it will progress to the third stage, which means it will enter, the decay will enter into the pulp. It is then you begin to have frank pain that can disturb even your sleep.
Wow. Now, how can a tooth decay be fixed? You did say that it can be fixed. How can they fix it, sir?
Yes, I say it can be fixed, and it is yeah, a person who is having such a problem need to go to the dental clinic. We have machines with which to remove the decay, and we have the chemicals to cover the resultant cavity. When we do that, there will be no problem again. The tooth can remain in the mouth painless, sometimes throughout life, depending on the stage that the patient came.
Now, sir, there is a norm that sometimes is a worm, sometimes is an infection. For instance, I have had tooth ache where I did extraction. There was no worm there. People believe there is this worm and the thing is eating. We live in a society where people think a worm is somewhere eating the tooth inside, and that is what is causing the hole and all that. Now, how correct is this belief in the society?
Well, it is just a belief. Just because of the way the pain comes, they feel that a worm must be sucking at the tooth. But the truth is that it is not worm. It is rather bacteria that cause the decay. So even if people claim that they went somewhere and they put something in the mouth and worms fell out, it is not true. Those people doing that, they know where the worms are coming from. They are not certainly from the teeth. It's not caused by worms, it's caused by bacteria.
Now, sir, what happens if we don't remove a decayed tooth from our mouth? What can that even lead to? Some people, like I said, I know people that tell you, oh, don't go to the hospital. I remember the last time I visited your clinic for a tooth extraction, people were saying, don't go. We have something, we'll pour inside a help, and the thing, the one will fall out and all that. I was like, please, I'm not interested. I just need to see a professional. And how badly can it get, or what can happen if we don't get to remove that decayed tooth?
Okay, I want to say that removal of a tooth is not the only treatment for a decayed tooth that have become too bad. As I said, when it has entered into the pulp, then you begin to have pain. Well, the cheapest and easiest treatment is to get the tooth out. But there are other treatments that can be given if the person is interested and he can afford the treatment. So as long as the patient is having pain.
Can you tell us some of these treatments, sir?
Okay, we have like root canal treatment, which is an alternative to extraction. If the tooth is not too bad, if the crown is still intact, just that the decay has entered the pulp, we can advise the patient to go for root canal treatment. What that involves is that we drill a hole into into the tooth to the pulp cavity, and then we remove the infected material in the pulp. When we now clean up and make sure that the place is well irrigated and all the proper tissues are out, the tooth becomes simpler. Then we now fill it. So, but that is a complex treatment that requires many other things. If there are sometimes there are contraindications. For instance, if the roots are not straight, we cannot do root canal treatment. So, and if the tooth is badly damaged, root canal treatment is not advisable. But if the decay have not affected much of the tooth and the patient is interested in retaining it, then it's then we go on to root canal treatment.
Wow. Now, sir, when you talk about the treatment, let's even look at if you don't remove For instance, somebody don't have the resources to do the one you talked about, so the easiest one is just to do an extraction, right? Now, if you don't get to,
Yes.
are there chances that the infection might spread to other parts of the teeth or the mouth?
Okay. Sometimes when the decay has gone deep, it can spread around that area, and that is why there will be swelling in most instances of the jaw, either up or down. There will be jaw, and if untreated, sometimes begin to swell and cause obvious swelling and a deformity. So it can spread around that area.
Okay, you did talk about the things we eat that cause to decay and whether it can be fixed or not. You've explained that. Now, so what are some of the preventive methods to avoid anything to decay, sir?
Okay, the preventive measure one, a regular visit to the dental clinic, because the average person having tooth decay does not know until it gets too late. So, and most of the people, even when the tooth is giving sign, they are unable to read the sign. So, the prevention, therefore, one is a regular checkup at the dental clinic, and we do advocate once in 6 months checkup. Then, so that is number one. Then, number two, right diet. The tooth decay is a disease of civilization, and how developed a society is, and that is why our forefathers did not have much of it. And we also discovered that children from wealthy homes that not this sugar, milk, chocolate, and all those sweet things, they have it more. So a person should avoid those things as much as possible, or after eating such things, one could just rinse the mouth, because if those things are not left in the mouth, the bacteria will not see anything to work upon to produce that acid. So watching what we eat and rinsing the mouth after eating such things. Then also good and regular brushing technique can also help to prevent it. So these are just the common ones.
Now, doctor, are there possibility that, for instance, somebody have a tooth decay and they treat it, and then, or maybe they had an extraction? Is there a possibility that they might just have it in the future, even when they try to do the preventive measures?
Okay, there is a fallacy that goes on, or a superstition that once you remove a tooth, you will continue to remove teeth. That is not true. And what I always ask people who are removing tooth for the first time is that, where did the decay of this first one come from? So the truth is that when a tooth has been is bad and it has been removed, then the doctor should tell you what to do. Most people,
Okay, I think we have network issues there with our doctor, our dentist today, telling us the do's and don'ts of what you don't what you need to eat, what you don't have to eat, or if you eat them, you need to have it. Go ahead, sir. We can hear you.
So some teeth may have been affected, some indicated for extraction, some indicated for filling. But if the person does not want the whole teeth to be examined, and then the doctor examine only the one that he pointed at, and then remove that one, then it could also be that the next one to the one he's removing has already developed a hole. And later now, this one getting and now giving him pain, he will feel that it is the one that was in the one that was removed that jumped into this. There's nothing like that. So if, in the nutshell, if a tooth has been extracted like that, the doctor should examine all the teeth and tell the patient what next to do. And if the patient obeys, and most patients don't obey, they will not have problems.
Wow. Now, doctor, you did talk about filling. Now, tell us more about the filling and then extraction. At what point can we fill our tooth? And you also talked about the period of time to go for a checkup, right? So now this is what I want us to
Yes.
get from this show today. Sometimes you see that the tooth is there. Sometimes people, for instance, I started having my own pains just for a little period of time. It wasn't up to 1 week before I came to you. I couldn't sleep for days. Now, sometimes people just have the pains immediately and it's so excruciating. How come is that? The signs were not there, no symptoms at all, sir.
Okay. Some people have a very high threshold for pain. So even if the warning is coming, they may not know. But in every rule, there is an exception anyway. So it could be possible that the patient was being given warning but did not take notice of those signs, or the decay just moved fast and entered pop, and so the pain just started. But most of the time, it must give some warning time, so, signs which most patients tend to ignore because some people have high threshold for pain.
Okay, now you did talk about the preventive method. Apart from the preventive method, what can be done, sir? Because let's talk about mouthwash. Are there some things you require? I don't need you to call names, but how often can we brush our mouth a day? At what point? And is toothpick we use today, is it harmful to our gums or the tooth, sir?
Okay, that's very good question. One of the ways is a good brushing technique. A person can brush even 20 times and not brush well. So most patients don't brush very well. Some people are in a hurry in everything, including brushing. A person should not be in hurry when brushing, so he should brush properly. There are times that we allow a patient to brush who feel that he's brushing well. After brushing, we will give the person disclosing tablet. Before and after, we will give the patient disclosing tablets, and those tablets will show that the patient did not actually brush and remove all the plaque that were in the teeth. So proper brushing technique is very important. Then fluoride has been known to help in strengthening the teeth. So a toothpaste that has fluoride should be used. And while we do advise that people should not be in too much hurry in brushing, we recommend 3 minutes because the paste ought to be in contact with the teeth for some time, and then to brush well too, because some people do destroy their teeth unknowing to them by using the type a wrong brush and brushing the wrong way. I've seen multitudes that have destroyed their teeth because of wrong brush and wrong brushing technique.
Now, sir, when you talked about the wrong brush, I know that we do have something we call soft, medium, and hard. And a lot of people
Yes.
believe school of thought that once it's hard, it cannot remove every dirt from your mouth. But we know that it's not a hard, but a hard way. I don't know how to put it, doctor. So, what do you recommend? And how can people
Okay.
brush? Is it like
Okay.
this or up and down, or how do we brush? What is the normal way to brush, sir?
Okay. Just as you have rightly said, there is a medium soft, medium, and hard. And some people are under the delusion and that the hard one will do the work better. Actually, it is the hard one that does the greatest harm. So for the average teeth, for the average person who have done scaling and polishing, I forgot to mention that as one of the preventive measures. There's something called scaling and polishing, which ought to be done regularly. That means if a person looks at the mouth, you will see some black or brownish things that are accumulated around the teeth. Those things are formed by bacteria and they become, and their home So from acting from there, they can cause different things: smelly mouth, bleeding gum, loosening of the teeth, and tooth decay. So if a person should have regular scaling and polishing done, it will go a long way to prevent tooth decay. So when it comes to brushing technique, we don't brush sideways. Rather, we advise people that they should brush the teeth the way they sweep outside, not the way they sweep inside, not the way they sweep outside. Yeah, me going to and fro. We brush one way from the gum, one way from the gum, not two ways, not sideways. So as if you are sweeping the teeth. But when we advise patients like that, they feel that that one does not cleanse enough. It's when they scrub it sideways that they clean, but that's not true. Just after you have had scaling and polishing, you need just medium, either the soft or the medium brush. Then brushing the upper jaw down, the lower jaw up, is enough to keep the teeth clean.
Now, sir, when we talk about a toothache, a lot of people believe also that once you drink some kind of things, we did talk about the food we eat. Now, apart from the carbohydrates, we did talk about things we chew. Is there anything you drink that can actually aggravate your bacteria or whatever it is that causes toothache, sir?
Yes, some of these fruit juice. I wonder if they are really fruit juice. They are packed. They are loaded with sugar. So it's just that they have to give them fruit flavor. So those things too can contribute to tooth decay.
Now, when we talk about tooth decay, we see that sometimes people too. You talked about the brushing. I want us to be particular about intention about toothpick. How dangerous is toothpick to your gums or to your tooth, especially when people eat meat and they feel, okay, I have to pick my teeth or my mouth and all that. Doctor, I want you to explain to us.
Okay, toothpick is actually dangerous to the health of the teeth, especially if used wrongly. And of course, most people use it wrongly. God, in His wisdom, has used the flesh, that the gingiva, to fill in between the teeth so that there will be no opening. But if for one reason or the other, that place opens up, then food will get accumulated on inside that place. And the tendency is to now use a toothpick to remove it. And instead of even using it to fling it out, they will dip it into it. By that, you create a vicious circle. The opening will be getting wider, more things will now enter, and more things you will now use toothpick the more. So a vicious circle will be setting. If for any reason you must use toothpick, don't dip it inside, but lightly use it to fling it out. But in an ideal situation, if you have food accumulated like that and you brush rightly, if the brush, the bristles are capable of removing those accumulated or stock particles that stayed in between the teeth.
Wow, viewers, this is our health. When we talk about your health, my health, of course, our health. Like the saying that health is wealth. And today's topic is quite interesting. Toothache or tooth decay. You know what that means. It's a very painful experience. If you have, I've been there like how many times? I don't know what I'm saying. Too much chocolate, I guess. But I'm learning, and of course, the last extraction I did like doctor here told me how to brush, what to do and what not to do, and of course, I believe in by the rules. Now, doctor, I'm going to ask you one question, but before then, we'll go on a quick break. As when we return, we'll now talk about the importance of going for that once a checkup in that period of 6 months. I know a lot of people don't even know that exists. A lot of people don't go for a mouthwash. A lot of people don't go and check. They're just living their life normal. Anyway, when we come back, we'll discuss about that, the importance of going for the checkup. People just feel only when they have fever when they have other things that they go and see a doctor. No, you should see the doctor, your dentist, to check your tooth to have a mouthwash. We'll come back to that after this break. Now, don't go anywhere. Stay with us. We'll be right back after the break.
SRTV Talent Award is here again. We honor, recognize, and appreciate hard work of individuals in the creative industry, films, music, fashion, and comedy. Nomination of various categories is now open at superiorradioandtelevision.com/SRTV-talent-award-registration or contact us via the numbers on your screen now. Powered by SRTV London in partnership with the Federal Ministry of Information and Culture, and lots more. Nominate, and nominates. Nomination is ongoing. Contact us at info@superiorradioandtelevision.com or via +234 814 358 2856 or +447 459 513 619. Powered by SRTV in partnership with the Federal Ministry of Information and Culture, elevating good leadership in our world.
Hello viewers, you're welcome back from that quick break. This is our health and on SRTV Studio London. We're reaching you live, and I'm here with our Dr. Isaiah. He is a dentist. Today is all about your dental health and care. You know how serious it is when you have a toothache, and these are the things we're trying to avoid. And now, doctor, you did talk about going for a regular checkup within the period of 6 months. Now, we live in a society where people do not take dental care seriously. Until now, they have, including myself, but I learned from the last one because the pain was very excruciating. Until people start having that serious pains, they don't care. They just eat. Some people don't even brush before they go to bed. They eat a lot of things without brushing, and they are okay. Now, doctor, how important is it for us to go for that checkup within the period of these 6 months you talked about?
Well, I think in our culture, it's not, we don't see it as important. But I know that in the US, it's compulsory. Every 6 months, they must go for a checkup. So any person who does not want to lose his teeth, any person who values his dental health, any person who believes that a person should remain healthy, must go for this checkup. It is not when a vehicle, for instance, a car, is having problem that you go to mechanic. Even if there's no problem, you after driving it for a long time, you take it for a checkup. That is the changing of oil and other things to be clean. So if you don't do that, you are reducing the lifespan of the car. So also it is with the mouth. So that is why a person should go for regular checkup. The reason is why 6 months is recommended is that if a decay starts immediately, it may, within all things being equal, within 6 months, it may not have become too late. So that is why any person who does not want to lose a tooth, with or without problem, to go for dental checkup.
Now, doctor, you know, a lot of people have the opinion that once you have a toothache, there's so many myths and facts about toothache. I don't want to take you there because it's going to take our time. The society believes if you have a toothache, it's contagious. You can kiss somebody at that time. Now, how correct is this, doctor? That is contagious.
Well,
you
that is
the same cup. You cannot use the same brush. You cannot kiss your partner. How correct is this, doctor?
Well, those are just fallacies born out of superstition. Those things are not true. Toothache is not contagious. It is not. Neither drinking from the same cup with somebody makes for or cause a tooth decay. No, it doesn't.
Now, doctor, before we let you go, we need you to tell us some of the facts about toothache, things people need to know. Like I did say, there are so many myths and facts about toothache, especially in the society, like in Nigeria, a lot of make-believe superstitions, don't do this, don't do that, if you do this. So I need you as a professional to tell us the facts about toothache and tooth
Okay,
decay.
tooth decay is just a normal and a biological process that takes place when the right conditions are provided. And one does not need to be superstitious about that because it's known. It's bacteria acting on sugar to produce an acid that dissolves the teeth. That is what people should know. But people do ascribe it to witches and all that. We are just superstitious. Those things are not true. And if toothache is not treated on time, well, some people, sometimes the treatment may be very tragic in that the infection could spread. When the infection spread, it becomes cellulitis. And sometimes blood with angina will result. And a death could result. I know when I was in UBTH Benin, there was one of our colleagues' mother who had this problem, and she was in the village for so long. By the time she was brought to UBTH, the swelling and the infection had spread too fast that do all we can, we could not save the life of that woman. So if the infection has become too widespread and the patient does not still come on time, he may lose his life, although it's not very common anyway, but there is a possibility that the infection could spread. Face becomes and the spread jaws and even spread tend that it covers the so and if it involves the last molars, the mouth can close as long as some weeks if untreated. That means eating becomes difficult. So the complications of toothache are many, and there is the fatal aspect of it, although the percentage of those that die as a result of that is small, but it's a possibility.
Now, I was going to even ask you, doctor, that if left untreated or not attended to on time, what are the major things it could lead to? You just said somebody lost their lives to this, which is quite sad. What are some of the major diseases or other health issues it can lead to?
Okay. When that happens, the infection spreading and going to certain areas, just as the one I have just described. And in some cases, the tooth may decide to just be breaking off. It will be breaking off in the mouth, and the pieces will be coming out. Or sometimes the pain could even stop when it has broken to an extent. In other words, that tooth is already useless. You cannot use it because it does not occlude with its partner in the other jaw. So with that, the tooth is already useless. Even if you are not having pain, you are no longer using it.
Now, doctor, there is this belief that I know in the Western world, in developed country, that once you have a toothache, you are not supposed to eat anything. You're not supposed to chew anything. Of course, you won't be able to chew anything. You have to swallow something not very hot. Maybe after some days before they will not have a mat or a proper cleanup. And in the Western world, after a tooth extraction, they do a cleanup immediately. Now, why is it so in Nigeria that after a tooth extraction or treatment, they will tell you to go after some days before they do a proper mouthwash? Because when I asked somebody in the US, they said all the time you will leave that bacteria, it might spread to another part of your tooth or the mouth. Now, how correct is this?
I think the most ideal thing is that cleaning should be done before the extraction, if it has to be done the same day. Because if after extraction you have to do that cleaning, after removing the tooth from the socket, there is bleeding and there is a type of sore there. So the cleaning will not be effective there and then. So what we do here in Nigeria, if the patient subscribes, is to do the scaling and polishing first before the extraction. And I think that is the ideal thing. But when we cannot afford the treatment for both, then we do the removal.
Oh, he was just saying something very serious. Yes, we have him back. It's all about your dental care today, viewers. We say health is wealth, and don't forget that dental care, your tooth, is a very serious issue. Go ahead, doctor.
Okay, that's what I've said. That so it needs to be done. The cleaning needs to be done because the plaque and the cartilage, they harbor much bacteria, and the volume in the mouth should not go beyond the threshold. So that is why the cleaning is one of the major preventive measures of tooth decay. So every person must make sure that they go for regular, we call it scaling and polishing. Another thing is that apart from the scaling, which remove this thing, the polishing tends to smoothen the teeth. And smooth surfaces don't easily retain that. So you know that sometimes of doing it, a patient will notice that things don't easily stick to his teeth because smooth surfaces don't easily stick in. So that is why we advise that it should be done and done regularly because the average person does not actually brush very well. So those things must form from time to time, which only else can remove.
Wow, quite educative today. Now, just the last question: can this toothache, tooth decay lead to cancer?
Yeah. Well, not likely, but cancer can or anything can cause cancer, but that is not one of the major things that it is.
Okay.
In every rule, there's an exception, so that's not the major thing that tooth decay causes.
Well, so doctor, thank you so much for being on the show today, our health. So our take home today is that we have to go for a regular checkup, watch what you chew, what you eat, and do a proper brushing. Don't brush as if you're sweeping. Brush like this, and of course use a not very hard toothbrush. Know how to pick your teeth. These are some of the issues. And of course, know what you eat, and after eating, do well to wash them off so that they don't stick to your teeth and they'll cause you bacteria or things that could lead to decay. And make sure you go for that checkup. I know Nigerians are very bad. Even me, I used to, but now I used to go for checkup. A lot of people, they don't go for checkup. They just only when they have anything that has to do with body, every other part of the body, they rush to the hospital. But nothing is wrong with my teeth. Why would I go for checkup? It's not that expensive. Even if you are not having a toothache, you can have a mouthwash. That is the good thing. The polishing, the scaling, and all that really helps you. Of course, have a good breath, fresh air as well. Well, thank you so much, viewers. I've been on the show today with Dr. Eduze Isaiah. He's a dentist and, of course, the Chief Medical Director of Vala Delta Clinic. Thank you so much for being on the show. We appreciate your time.
It's a pleasure. Thank you so much.
Yeah, you have been so busy. I'm very sorry. Next time we'll tell you way ahead, so you prepare yourself very well. Well, thank you so much, sir.
We are grateful. Thank you.
Yes, viewers, this is our health. You know how we do it here, where we'll talk about your health, my health, and our health, because health is wealth. And today's topic was quite interesting because it has to do with tooth. And mouth is where you use all the time. You practically use your tooth every other day. You eat, you drink, you chew, you break, you crack. And that is the reason you have to go for a regular checkup. You've heard from a professional. I'm not the one that said it. Yes, I was a victim, but now I think I'm free. You can't believe that I did 3 extraction. He actually did the last one. He had to school me on what to do, how not to do, and look at us today. So you can also live above that toothache, that headache all the time. And sometimes, you know, a lot of we, especially Nigerians, they tend to, most time, when you are having a toothache, they just suppress it with one, I've forgotten that tablet, they go and buy, they put it or they swallow, it goes down and they leave for another month. No, you can't keep taking medications without seeing a professional. It's your health. You have to be very intentional about anything that has to do with your health. And on that note, I'm going to wrap up the show. But before then, remember also that know what you eat. Healthy diet, healthy meals. That is what he said. Healthy. Know what you drink. Look at the content of the things you take in. You might actually be taking in things that will be so harmful to your health. So eat well, drink a lot of water. If you must drink a lot of water. Of course, water is good for your health. Before I let you go, don't forget to hit on the notification bell. Follow us on all social media handle, Facebook, Twitter, now X, Instagram, and of course, YouTube. Hit on the notification bell so you'll be getting our updates. Leave us with your comments. We'd love to hear from you. And of course, invite somebody to the page. I remain yours truly, Princess Kessy. This is our health live from SRO TV studio in London, the world's capital city. Of course, while you are out there, remember that peace is priceless. So let's give peace a chance. The economy is biting hard, but remember to live healthy. Remember to have a good mouthwash. Remember to always change your brush on time. I was going to ask doctor that one, I forgot. A lot of people want to use one brush for a year or 2 years. Oh my goodness, no. You have to make sure you have, I think it's the ideal time is 3 months to change it. It's quite cheap, so you should, and know the kind of toothpaste you use. He did talk about the type to use. Make sure they have that, and don't be in a rush. When you brush, leave the toothpaste there for some time, like minimum is 3 minutes, so that they can go in and do the work they are supposed to do, so that you have good dental care, your tooth is okay, your gums are fine. I'll see you again on the show next time. And like I said, make sure you're nice to somebody today. Put a smile on the face of somebody today, because everybody is actually going through a lot. But be at peace with others, and of course, others will be at peace with you. Bye for now.
SR TV. Innovative content.